Join me for Eye on Health every Thursday at 5 p.m.
We are happy this morning to have Dr. Luke Maxfield back on the show. He is a dermatologist with the new Aspire Dermatology and Skin Surgery Center. Good to see you back.
Thank you. Glad to be back.
In the midst of your grand opening, y'all launched on July 1, so thanks for carving out some time.
Absolutely.
To come and talk to us. So the last time Dr. Maxfield was here, we talked a little bit about sunscreen. All of us are wondering what's the right kind to put on. So you said your favorite kind is the one you'll actually wear.
Right. That's tip number one is just, it's very personalized. And sunscreen, more than many other skincare products, is actually something that I think is very much up to the individual purchasing and using. Because, like I said last time, the effectiveness isn't in question. There are caveats, there are exceptions, but it's regulated. It's actually an FDA regulated ingredient. And so it's to a very high standard, and if you get 30 plus, then the rest is basically up to you.
Okay, so can we talk a little bit about what's a myth and what's a fact with sunscreen? Okay, I have heard, since you mentioned 30 plus, that really, if you see a SPF 70, it's not that much more effective than the SPF 30.
This is true, and this is why I still stick with 30. Some recommendations, you'll hear some dermatologists say 50 is the preferable option, and once you get to a certain threshold, it's not a linear improvement. So 30, 50, 70, 90, 100, it doesn't increase like this. It's a curve, and it starts to plateau around 30. So after 30, the benefit is incrementally smaller. Not that it's non-existent, but it just is much less. And so the difference between 30, 50, 70, and 90 in terms of percentage points is just perhaps 2%, 1 to 3% more effective overall.
It can become expensive buying sunscreen, and there's a buzz going around these days that you better get a certain type or a certain quality because sunscreen can cause cancer.
So this is a very deep topic. The idea that sunscreen causes cancer, I think, got most of its momentum around this thing called benzene, and there was a report from a lab, I think it was called Valisure, that published something that said benzene, this cancer-causing ingredient, is found in a lot of your sunscreens. Now this is not new, and actually benzene has been found in a lot of cosmetic products, in certain hair products, certain body products, but for some reason, the linkage of that in sunscreen stuck. And now they seem to be irreversibly linked, and it's wildly inaccurate because it was a contaminant. Benzene in the sunscreen was found to be a contaminant as a part of the manufacturing process, and it wasn't a direct cause of the sunscreen itself. And so that being maybe a year and a half ago at this point, I mean, sunscreen is still sunscreen. Sunscreen itself very directly prevents cancer, more directly than almost anything else probably in the world.
And in order for the sunscreen to do its job, does it have to have that benzene in it?
No, benzene doesn't belong in there at all.
Oh, that's what you mean by it being the contaminant.
Yeah,
okay,
it's not something that should be in there. It's not something that is in there.
So does that mean that once that was discovered that the benzene was in there, that's been eradicated and now that's no longer an issue?
You'd like to think. There hasn't been a lot of follow-up on that. There were a lot of wide recalls. I'm sure the brands are very, very hyper aware that they're under the microscope, because it's honestly all that this Valisure lab does. They also found this in acne treating products perhaps a year down the road. But again, this is all they do. So every company knows they're under the microscope, and so they're hyper aware and hyper protective to prevent that from coming.
A lot of us have kind of become accustomed to looking at ingredient lists, and the fewer the better, we tend to think, at least with our food. Is that the same case with sunscreen, or?
I actually do think that's a great rule of thumb. I think it's brilliant, because the more you add, the more likely you're going to have some potential allergens or irritants in it. So a simple product is often the best product as long as it's functionally good.
What is a tanning oil?
That's a good question, because for my patients over the years, the most common things I've heard is that they've used a combination of iodine and baby oil and motor oil.
Oh,
and those,
stop
No,
it.
I'm serious. Even this last week with patients, I would say
motor oil?
4 or 5 patients, even within the last 2 days, have told me, oh, when I grew up, we didn't have sunscreen. We just used motor oil, like from our cars, or WD-40 to bake. And so a tanning oil, although there are tanning oils with like a low SPF, pretty much non-existent, not helpful, tanning oils, if they're there to help you get tan, they are not doing any effective job and should be ignored.
Okay, so plenty of people watching have got teenagers in their lives, and they're thinking, okay, doc, help me out here. Because they're going to go to the beach and their 18-year-old daughter is going to be like this, soaking up the rays every single day. Is a little bit every day better than a lot in one day?
There is only one benefit from getting a baseline tan, because that's basically the question, is if you get a little bit beforehand, can it be beneficial to prevent future burns? There is some truth, because your body's defense mechanism is to create pigment. And so if you get some sun exposure up front, your body creates a tan to protect you from future burns. The problem is even tanning without a burn is damage in and of itself. And so there are studies showing, especially in the setting of indoor tanning, the UVA rays that are associated with tanning, even though they don't cause burns, cause cancer. And so cumulative tanning also is harmful. And again, I'm not saying don't go outside. That's never my motto. It is just be protecting your skin. You probably should never lay out to tan deliberately. And if you're looking for an option just for tanner skin, I would highly recommend self-tanners with that sugar molecule dihydroxyacetone. Much, much safer. It is technically difficult to get a nice, even fake tan, but it's wildly safer.
Tanning bed's a no-no?
Yeah, I'm shocked that tanning beds are not just completely illegal at this point, or have a label that even surpasses tobacco smoke or cigarettes. Extremely dangerous.
Because if you're in there for what is it, like 10 minutes or 15 minutes, that's the equivalent of what, a day's sun exposure or something?
I don't know that exact statistic, to be honest.
But it's high.
It's high. And we know that even just like a couple tanning exposures in a tanning bed increases your risk for melanoma. And just anecdote here, so I'm a Mohs surgeon as well, so I deal with a lot of the highly aggressive skin cancers or on high risk areas like the face. The most aggressive skin cancers I've seen on young individuals, I think without exception, because I ask my patients when they come in just a little bit of their backstory. All of the skin cancers in younger patients that are aggressive in high-risk areas have been directly from tanning, in my opinion. And I'm talking about the 30-year-olds, the 40-year-olds, even some 20-year-olds, where it is just consuming part of their nose. The treatment is difficult, the repair is difficult, and it's a lot to go through, and it's almost all from indoor tanning. So
the thing to know then is where to find him, because he's very real. He's passionate about being here. He lives life in his own way. He's an avid surfer, and he likes to be outside too. So he knows the fine line you walk between protecting yourself and living your life, and he wants to help you find that. So here's where you'll find him. It's Aspire Dermatology and Skin Surgery Center. Look for the 30+ SPF on the sunscreen. Put it on regularly. Don't use a spray unless you're going to spray it into your hand, and please don't use motor oil.
Please, for the love, do not use that.
I'm Jonathan Lawson, here to tell you about life insurance through the Colonial Penn program. If you're age 50 to 85 and looking to buy life insurance on a fixed budget, remember the 3 Ps.
The 3 what?
The 3 Ps.